All right. Jenny Rogers on the ones and twos. Here we go. Welcome, everyone, to the Mid-Level Show. This is the show where we get performance medicine's best on a Zoom call here with what we're in multiple locations here. We get everybody together and we discuss the latest Dictations podcast and the doctor's note that Dr. Rogers sends out every single Monday. For those of you who are not subscribed to Performance Weekly, you're definitely missing out. You need to sign up. It's in the show notes of this podcast and every other podcast we put out. We would love to see you guys there. Guys, we've got a fascinating conversation today, and I know it's something that's really close to Dr. Rogers' heart, no pun intended, but it's on blood pressure. And this week he talked about the importance of controlling your blood pressure, and I took a few things out of this myself for my own health, but I want to start with you guys. And before we do that, I just want to make sure I introduce everybody. We got Andy Rogers from the Kingsport and Johnson City office. We got Fran Wilson from the Johnson City office, and we have Amber Butler from the Kingsport office. Guys, thank you so much for being here, and we're just going to jump right into it. Andy, what do you think? What's your thoughts on this latest podcast episode on blood pressure?
Hey, I think it was a really great note, and also really it's weird timing. Dad usually sends out notes whenever I have patients that are dealing with exactly what he's talking about. Literally on Friday, I had two patients come in who had very high blood pressure readings on multiple. We did it over 10 to 15 minutes. We had the patients calm down, and their blood pressures were high. And it was just a change of medications that we needed to do. We did acute clonidine for both of them in the office, so it acutely came down. So we felt like it was safe for them to leave. But it's just funny that Dad will send a giant note on blood pressure, and I didn't tell him about these particular events. Blood pressure is important, and it's something that can be in our control. I feel like a lot of what we talk about on the podcast is take control of your own health, take your vitamins. Blood pressure, get a cuff. I think that was a really great tip for anybody. Get a cuff. I wouldn't become obsessive over it, but I'd check it if blood pressure or high blood pressure is in your family history or in your personal history. Start checking it once a day at your calmest moment of the day. Don't check it right after you run or when you go into a dental office like I'm about to do, because your blood pressure will be high. But it's nice to take note. It's your inner, I describe it to patients as your inner piping. You don't want sludge running through the pipes, and you don't want the pipes to be too tight, and things are on the other side of the pipes. If you have pressure in the pipes, it puts pressure on your kidneys, and it's coming from your heart and your lungs. Blood pressure is important.
Fran, why don't you go ahead and kind of send in your 2 cents and build off of what Andy just mentioned?
Well, I liked what Dr. Rogers had said about it being, that there's all these myths about it, that it doesn't really matter, that you don't need to worry about it because it is silent and you don't necessarily feel blood pressure. I mean, sometimes when you're really, scared or whatever, you can feel that in the sympathetic nervous system, the fight or flight, you can tell your blood pressure's up. But a lot of times you wouldn't even know your blood pressure was high. So I think this whole idea of monitoring your health, check it. I check it a lot. I check my blood pressure all the time. Just
I have to know. I'm going to interrupt you there. How many times a day are you checking your blood pressure?
Oh, I take it 2 or 3 times a day.
Love it.
I mean, I know that's excessive, but I just want to know, and I want to make sure, and I want to see what makes it go up and what makes it go down. And I like to, the same thing like with sleep. I like to monitor my sleep, and we have so many great devices now where you can monitor all these aspects of your health. And when you go into a physician's office, you only see a practitioner for a very short period of time in one day, and that does not give you the total picture. So even when I tend to have high blood pressure readings in doctors' offices. So I've always been a little bit nervous, like, oh, maybe it is high. But then I come home and I take it, and I'm like, no, it's really fine.
I have a question, Fran. I have a question for you. When you're at home blood pressure cuff, I've gotten questions before. on what type, like wrist and arm. I've always been under the understanding that arm is more accurate than wrist, but is that something, what do you use at home?
So I take my own with stethoscope and a blood pressure cuff.
Okay. So for those who don't know how to do that, what should they take at home, you think?
I think there's so many great ones you can just get at like CVS or Walgreens. And like Dr. Rogers says, the wrist ones I think are really convenient and easy to use. You just have to hold your arm in the right position and they give you instructions. And I think, as long as it's in a normal range, if some are maybe a little bit off compared to other ways, it's not really going to matter if your blood pressure is running 120/70, you're fine. And if it's 122/72, okay, you're you're fine. I mean, if you get your general readings and you get used to your blood pressure method, you'll know if yours is going up.
Right. I think that's good.
Amber, why don't you go ahead and jump in there and tell us kind of what you got from the note, what your thoughts were as a young person, and also, as a provider treating lots of people with blood pressure medications, what's your thoughts on it?
Thank you for referring to me as a young person, Ben. Actually, though, I did take away about getting a blood pressure cuff because, like you said, we're young, we're healthy. Why do we need a blood pressure cuff? But as Fran was saying, and Andy, knowing what your normals are is going to help, whether you go in and have like a white coat hypertension where you just are high in the doctor's office, or if that number starts slowly increasing over time. And then I thought it was a very timely note because we've seen one of the highest indicators of morbidity with COVID-19 is hypertension. And so it's really a wake-up call for those who have it to get it under control, whether it's through natural means like losing weight. That's one thing I love about performance medicine is the first time we get a high blood pressure reading, and let's say it's someone who's there, maybe even there for a diet consult, it's not just immediately putting them on a blood pressure medicine as much as it is addressing the underlying cause or trying to get them to lose weight. Now, obviously, if their blood pressure was continually running high, we're not afraid to use medications because as he listed in the note, there's lots of really good ones that you can use on different people groups or types, depending on how you respond to a medication. But I just thought it was timely. And I thought even in our own life, I've always had a lower blood pressure, but it's something that we should get a cuff. We should know what our normals are and parameters and make sure we take this time to get it under control and make sure it's good.
Yeah, I totally agree with that, Amber. And just a quick to build off what Fran was saying and a little bit of a behind the scenes segment here is as I was going over the doctor's note with Dr. Rogers on Sunday night, and originally he did put you should try to check your blood pressure multiple times a day. And then he's like, look, we need to take that out. Let's replace that with frequently because no one's going to check it multiple times a day. And then Fran comes in and says she's doing it multiple times a day. So I love that you said that, Fran. And I think you're wonderful for checking it multiple times a day. It's so cool. So anyways,
diabetics check their blood sugar all day long, right?
That's exactly.
That's true. Well, sometimes we don't. It's whatever. Sometimes you just go by feel. No shame. I'm kidding. Don't do that. If you're listening, do not do that. Check it multiple times a day. I think it's important with Amber, with what you were saying about medications. There's a lot of things too, I think, that he does bring up in the note that you can start considering about. I don't want to say take a check in your own life, but a lot of the times we just want to go to medications. So yeah, blood pressure's high, throw on the Losartan. It's a great drug, and it is a great drug. But I find that if you really start tuning into what you're doing in your life, if you're not taking time to not necessarily meditate, but to relax, if you're stressed all the time, if you're having multiple cups of coffee, if you're having, golly, I can't tell you how many people come in on energy drinks. Those things are trash. Literally, energy drinks are trash. Go burn them outside. They're not helping you out. Something else is off if you have to have energy drinks for energy. A lot of the things that we're putting into our bodies and into our tank, into our system, our temple, can be causing high blood pressure. Or at least... Yeah, go ahead.
No, I don't know about you, Andy, but like what they taught me in school, or Fran, was like, okay, a person comes in with high blood pressure, you start them on this class of medications. You check them in a month. If it's still not right, you just add a second medication, because blood pressure medicines all work differently. So I have patients, I have family members who are on 3 and 4 blood pressure medications to get them under control. And while I'm not saying that's never indicated, as you're saying, why don't we look at the life factors that we can control instead of hopping on to another prescribed medication with more side effects?
Exercise brings down your
Modifiable
blood
risk
pressure.
factors. We should,
Yes.
any modifiable risk factor, you should take some control and use it. Yeah, exercise is huge for lowering blood pressure. Diet.
Fran, real quick,
used
and then I'm going to get to Andy. Fran, will you describe what you mean by modifiable risk factors, just for the listeners out there?
So your BMI,
Okay.
which is your body mass index, like how heavy you are, and then even where your fat is distributed. You know, if you have that waist to hip ratio that is not correct, and you have metabolic syndrome, you end up having higher blood pressure. You can modify as you get older, like we do at Performance Medicine, your hormone balance. Women tend to not have as much high blood pressure as men before menopause, and after menopause, they catch up. And women also tend to gain a lot of weight. The heaviest women, the highest rate of obesity, I think, is for women is 55 to 59. Well, you've lost your hormones, you're gaining weight, your blood pressure goes up, you don't feel good, you're not exercising, and it just mushrooms. So you can modify risk factors by looking at all these parameters of your health and changing the things that you can change.
Smoking is a modifiable risk factor.
And come in to see us. You know, don't feel like you're out there on an island and let's say you're obese and you're like, my mom's obese, my whole family generations have been obese. Like, that's one of the reasons why we're here at Performance Medicine, is to look at the underlying factors, the metabolic issues that are happening, and get you on the right track. So don't just feel stuck and be like, well, I'm on 4 blood pressure medications because I can't do anything about, you know, my weight, or I can't find time to exercise. I have a sedentary job and I have to keep this job, you know. So that's one of the reasons why we're here.
Andy, I think you were going to say something.
No, I think the modifiable risk factors, I think I can take I think we all can. I drink way too much coffee. I love it. And I find that I'm not even doing it for energy or to wake up. I find that it's just a habit. There's a lot of things that we can be doing that over time, and there's different things about coffee, but I'm just saying that every one of us, it's not just the person that's morbidly obese that has a lot of modifiable risk factors. We all have modifiable risk factors. Better sleep. They talk about better sleep. I just took this quiz. Have you all heard of chronotypes?
Are you a lion, a bear?
Guess. I want you to guess. I want you to guess what I am. I'm
a lion.
I'm the most common one.
Oh, you're a bear.
I'm a bear. I want to do stuff in the middle of the day. And I'm prepared, but I didn't know about chronotype is how you sleep. It's like lion, bear, dolphin, and wolf. Is wolf the other one? I think wolf is the other one. Yep, and it tells you like different ways of how. I don't know. It's pretty cool, but sleep is huge, and if you do not sleep, you know that's. Would you even count that as a modifiable risk factor? Some people just can't sleep.
Well, yes, it's modifiable because you can start working on it.
That's true.
There are lots of things you can do for sleep apnea. Is one of the things that can cause hypertension. And there are things that can be done for sleep apnea. And then all the breathing things that we've been learning about. You know, there are things that can be done.
People don't need to be scared of medications. We're talking about a lot of modifiable risk factors. There's great medications out there. Our favorite, which he talks about, is losartan, least amount of side effects. It's an angiotensin receptor blocker. It works on your kidneys, and they find that it's kidney protective. They put a lot of patients with diabetes on ARBs or ACEs anyways. ARBs and ACEs, like lisinopril, those are cousins. Those are like the same thing.
And I'll build on you. I'll build on top of that, Ange. He mentions in the note towards the end. He says, when you take any prescription medicine, you need to know how they work, side effects, and what kind of blood monitoring needs to be done with them. I thought that was a really important line, especially because it came right after the section on blood pressure medications. And, when Amber was saying that one of her, family members, they're on 2, 3, 4 at a time. And I think that's one of the most important messages we have at Performance Medicine, and something that he's talked a lot about, is when you get put on a medication, make sure you know what talk about taking control of your own health. Understand what you're taking, how long you need to be taking it, what those side effects are, and then go. I think we'd all, me as a non-clinician, we'd be so shocked to know how many people are on medications that they have no understanding of why they're on them in the first place.
I'd further that with knowing what the goal of the medication is. What's your goal? Is the goal to get blood pressure down, or goal is to protect your heart? Whatever, even vitamins too. What's the goal of this particular vitamin? How should I feel? Should I feel anything from it?
Speaking of vitamins, was it potassium with magnesium? Magnesium with potassium that he mentioned? Does anybody want to build
through
on
life
that?
extension?
Through life extension, it was the magnesium with potassium, I think is what it was.
To lower blood pressure.
To lower blood pressure. So anybody out there who is looking for more natural alternatives to bring that down, magnesium with potassium. Potassium is what he talks about in particular in this note. Guys, any final thoughts? I know we're running out of time regarding the medications or any of the natural things that we can do to help us lower our blood pressure or maintain it.
I have no closing thoughts. I think this is great.
Well, guys, thank you so much as always. To everyone listening, thank you. Thank you for joining us every single week. This is the Mid-Level Show. I am with the Performance Medicine Mid-Levels every single week. We're recording on a Tuesday today, which is awesome. I'm excited about this new time, guys. This podcast will be up here in a few days, as will the video. Guys, thank you so much. And as always, we'll see y'all next time.
All right, thank you.